Hi, my name is Mackenzie, and today I'm going to be introducing you to the world of healthcare. As a student who is currently pursuing a future in healthcare, I've been taught many different skills. One of the basic but crucial skills that we learn is how to take accurate vital signs. There are multiple different vital signs. There's temperature, blood pressure, pulse, respiration, and SpO2. And each of these vital signs teaches us something very vital about the body. And if they're not within the normal limits, this can raise some red flags for your provider. Today, I'm going to be teaching you how to do manual blood pressure. There are many different illnesses where your healthcare provider may suggest that you take your blood pressure at home. And all you need for that is a sphygmomanometer, also just known as a blood pressure cuff, and a stethoscope. So before we begin, I'm going to be teaching you a little bit more about why blood pressure is important. Blood pressure is more than just a number on a chart. I'm sure you've heard your doctor or healthcare provider tell you your blood pressure and you don't really understand, but basically blood pressure is a vital sign that provides critical insight into our heart health and overall well-being. There's a normal range for your blood pressure, and that's 90 to 119 over 60 to 79. It's written as a fraction, as you probably heard me say, over. The top number is your systolic pressure, which means that's when your heart contracts, and then the bottom number is your diastolic pressure, which is when your heart relaxes. If you know a little bit more about the cardiovascular health, or anatomy, I'm sure you kind of know more of what that means, but basically, we'll just keep it simple for this. Systolic is the contraction, diastolic is the relaxation. There are 5 main steps when it comes to taking blood pressure, and that is preparation, location, inflation, deflation, and documentation. So step 1 is preparation, which is gather your supplies, which I have already done, and then make your patient comfortable. So if you're the patient, get comfortable. If you have someone else, make sure they're comfortable. And that would entail making their feet flat on the floor, having their arms supported, and then also being at rest for a few minutes before you perform blood pressure, just so that you get an accurate reading. Step 2 is location. So we're going to locate the brachial artery, which is the one that is in your little elbow pit here. So I'm going to just feel for his brachial artery here. And once you find that, you're going to take your blood pressure cuff, which has many different markings on it. But the one that we're looking for right now is this one that says artery. And we're going to line that up with the brachial artery that we just located. And step 2 is inflation. But before we get to that step, I'm going to kind of explain the gauge here. There might be a glare on that, sorry. So this is a lot of pressure gauges. You might have seen it if you've inflated your car tires or other things, anything that involves pressure. I'm sure you've probably seen one of these gauges. But it goes up in increments, but each little dash is an increment of 2. So you will never read an odd number when you're reading blood pressure off of a gauge here. If you're doing automated blood pressure, it will provide you an odd number, but if you're reading it off of a gauge, it'll always be even. And I will provide a picture later on of a closer image of a blood pressure gauge, just so you can read it better, because I know it's kind of hard on this. So now we'll get into step 3, which is inflation. So we're going to be multitasking here. We're going to locate the radial artery now, which is the one on the wrist, and you're going to locate that. Once you feel that, you're going to begin inflating your cuff, which is you use this little knob here to close the valve and open the valve, which allows for inflation or deflation. And while you inflate it, you're going to look at the gauge and note when you can no longer feel you can no longer feel the radial pulse. So I'm just going to inflate this cuff here. And his stopped around 130. And then with that number, you're going to add 30 to that, because this will now tell us how much we should inflate the cuff in order to hear the brachial pulse. So you're going to now put your stethoscope in and perform step 4, which is called deflation and listening. So we're going to place the stethoscope so we can listen. and inflate the cuff 30 more than the number that we just found. So I'm going to inflate to 160. And once it's inflated, I'm going to begin slowly deflating the cuff and listen for his pulse. So I heard the first sound around 138, and you want to note the first and second sound. It's first and last, sorry. So the last sound was at 78. So I got 138 over 78 was his blood pressure. And that first sound that you hear is a systolic pressure, and that last sound you hear is a diastolic pressure. And then this is more important if you're in the world of healthcare, but step 5 is documentation. So you're going to record the measurements of both systolic and diastolic, or if you're doing it for your own good, maybe just make note of this somewhere so that you don't forget. So to conclude, your manual blood pressure is something many healthcare providers perform, and you most likely have had it done to you before. I'm sure a lot of us have had our blood pressure done if we've gone to the doctor. But being able to keep tabs of your own cardiovascular health is so important, which is why I chose to teach you guys how to do manual blood pressure today. So let me recap those steps for you. Step 1 is preparation. So you're going to make sure you gather all your materials and then make sure you're comfortable or your patient is comfortable. Then you're going to do location, which is locate the brachial artery. Step 3 is inflation. So you're going to inflate the cuff while feeling that radial pulse and watch for when you can no longer feel it anymore. Step 4 is deflation/listening. So you're going to inflate it all the way up to 30 more than the reading that you got when you were feeling that radial pulse. And then you're going to begin slowly deflating it and listen for their heartbeat. And the first sound that you hear is their systolic pressure, and the last sound you hear is diastolic pressure. And then you want to document that, which is the final step, fifth and final step, which is documentation. I'm going to insert a little clip at the very end here. I might go a little over 8 minutes, but I just want you to be able to listen and see what this will actually sound like if you perform it. So yeah, hope you learned something today.